Good day, my friends. This is Dr. Digambar. Well, these days and always, right from the beginning of my practice, I've been facing a lot of migraine cases, especially young girls. Okay, just in 15 and 16, that's the time usually when it starts. And they are all stressed and worried at that time. They come with these headaches of varied nature. Some will say a mild headache, for some it's a very severe headache, for some it is headache associated with vomiting, for some it is giddiness. There are rare cases where when they get headache, they even get paralysis, temporary paralysis on one side of the body. Friend, this is migraine. But before I give a diagnosis, I always get one CT scan done to rule out any pathological or any condition which must have been, which is a curable thing and which could be there. Once I've done one CT scan, I'm very clear that I have ruled out any pathological thing. Okay, this migraine headache is more amongst ladies. It's not a disease. It's your hyper response to your neuroendocrine or neurovascular system. It's a hyper response. And this is a disease of intelligent people. It's not a disease of people who have a very low IQ. No. Suddenly it comes. Sometimes it may be associated with an aura, like some zigzag lines that you get, or suddenly you find you can't read the things properly. And this is what happens. And then the headache sets in. For some people, it starts suddenly. But basically, it is associated with stress, tension, not sleeping properly, hunger, going out in the sun, and associated with periods. And lots of such things, sometimes associated with food. I've seen people getting migraine after eating bananas, eating groundnuts, then red wines, then cakes, chocolates. There are a variety of things which induce in particular person. You have to search and find out what induces a headache inside you. This basically, this headache, I would call it as a neuro, psycho, and socio-vascular headache. Your brain is involved, definitely. Your mind is involved, your thoughts are involved, your stress is involved, your psychological way of looking at your life is involved, your social life is involved. All these combination precipitate these migraine headaches. And I just now said, it is not a disease, it is a problem. It's a very severe problem. Those who get it, this is one of the most severe pain that you can bear. And it's very easy to take care of this. You have to take care of it. There are various drugs we use for headache. We use paracetamol. We use your triptans. We use drugs like anti-vomiting drugs. Then there are other drugs like ergotamine, dihydroergotamine drugs. Okay, a lot of these combination, beta blockers, antidepressant, all of these drugs give a combination, and we are able to give a good relief to these people, because many times many of them may end up in even losing 1 or 2 days where they're forced to sleep. Okay, this is that severe a headache. Okay, so what if you have this headache? What you have to basically do is relax and sit down and analyze this headache. Okay, this headache, and make sure that this headache is not going to give you a brain tumor or not going to cause you any serious problem. It's not going to make you die. Only thing, it remains with you throughout your life unless you manage to throw it out. And it's possible to throw it out. Yes, my friends, it's possible to cure this migraine once for all. It is possible not to suffer from this migraine so much. It's possible to alter this migraine so that you don't lose even 1 hour of your activity. I have been suffering from migraines for years together, but I have learned to live with it. I have learned to conquer it. I have learned to go beyond. I've got, while I was sitting on a stage and giving a speech, I've got migraine. beginning of a migraine, and I've continued with my talk, with my teaching completely. So it is possible not to waste your day or even a few hours. So it is possible. What you have to basically do is, number one, understand that it is a migraine. Confirm it with your doctor that it is only a migraine, because there are some more headache like tension headache, cluster headaches, and so many other headaches which look similar to migraine. Okay, you have to definitely rule out all these causes from your migraine before you really learn to manage with this migraine. So accept it. Once you accept it, is half of it is sorted out. Number one, learn to relax. Change your lifestyle. Change the way you look at the world. Change the way you look at yourself. Learn to be happy, relaxed, good person. Learn to do that. Yogas will help you, pranayam will help you. So many of these drugs that we use also help you to do that. And if you can take over, from your very intelligent, irritable, or easily excitable personality, or easily depressible personality, change it into a nice, good personality, and you can easily learn to live with. Make your doctor help you to live with migraine. There is, I would say, don't go to cure the migraine. First, you learn to live with migraine. The moment you learn to live with migraine, that is the time it's easy for you to even get rid of this migraine. Thank you so much.